medical providers who don't have a lot of knowledge around hypermobility and Ehlers-Danlos syndrome. When they did learn about it in medical school, it was very short, very brief, and typically would cite like the most severe worst cases. A lot of people have struggled for a long time to get answers as to why do I seem to struggle more than other people. The typical length of time on average that it takes someone to be diagnosed finally with EDS is 10 years. There's a saying, when you can't connect the issues, think connective tissues.
That's fun and cute and also sad.
It's on you ultimately to do something about it and to change the course that your life is on. So if you are struggling with hypermobility and you're having pain and you're having injuries and you're not happy with the things that you're able to do or the way that you feel in your body right now, it's kind of like just a hard truth that it really comes down to you.
Welcome to the Whealth podcast, everyone. My name is Andrew Dettelbach, and this is my lovely wife,
Katie.
And we are owners at Whealth. We also have a third owner named Cameron, who you may have seen on the podcast before. I decided to bring Katie on here, and I would like her to come on for future episodes in regards to hypermobility, among other topics. But hypermobility is one of our big focuses here at Whealth, and focal points. One of our biggest focuses here, and she's the person that I've learned everything from about hypermobility. So, Katie, we have 5 questions for you that are fairly basic, but I think they're things that people need to understand about hypermobility, what they can do with it, and how to address some of the fears around some of the common complaints that we see on social media and like Reddit threads and stuff like that. The first one, what even is hypermobility?
Yeah, so the simplest explanation is just an excessive range of motion in the joints. So a greater than normal range of motion in the joints. So you can have hypermobility in just some joints. You can have it in all of your joints. Some people can have hypermobility that is asymptomatic, meaning it doesn't cause them any symptoms. They're not struggling because of it. They're just really bendy, and that's fine. And then you can have people who have a lot of symptoms. They have symptomatic hypermobility. And then there are different categories that you can fall into when it comes to hypermobility. So some people have heard of hypermobile Ehlers-Danlos Syndrome. That is a connective tissue disorder. So that is one category. There are also other types of connective tissue disorders that have hypermobility as a primary presenting symptom other than Ehlers-Danlos. And then there is something called hypermobility spectrum disorder, which is very similar to hypermobile EDS. It's really just different diagnostic criteria. So there's a very specific set of criteria that you must meet to be diagnosed with hypermobile EDS, Ehlers-Danlos syndrome. And if you do not meet that criteria, but you have all the same symptoms and problems, then you would be designated as hypermobile spectrum disorder.
So wait, the same symptoms and problems you didn't meet for the other one. So why are there 2 different distinctions?
Yeah, so EDS, Ehlers-Danlos syndrome, there are 14 different types, and the hypermobile type, which is a little bit confusing because all of them have hypermobility as a symptom, but there's one that is called the hypermobility type. That one does not have lab testing, so they cannot do genetic lab tests to say with absolute certainty. They don't yet know the genetic markers, although there is some great research happening right now, and I think it's not that far off. But as of right now, they can diagnose the other forms of EDS through lab testing. But hypermobile EDS is just a clinical diagnosis right now, meaning it's based off of exam and symptoms and the diagnostic criteria. And again, that diagnostic criteria is very specific. And so when you look at a big group of people who have symptomatic hypermobility, who don't don't match the other connective tissue disorders or other explanations for hypermobility, and they also don't meet the cutoff for hypermobile EDS, then it's hypermobility spectrum disorder. And some people kind of think that HSD, like, well, mine's not as bad. I don't actually have EDS. I just have HSD, but that's not how it works. There are people who are diagnosed HSD who struggle much more than some people who are diagnosed EDS. So it's a little bit confusing. And when you speak to professionals and experts, the treatment is the same, whether it's hypermobile EDS or HSD.
It seems to be completely up to opinion of the individual you're seeing. I bet if you went to 10 different people, you'd probably get different. 50% would say this and 50% would say this.
Yeah, my understanding is that, even the experts it's something that even they aren't fully in agreement on or can't really explain exactly like what the difference is between the two, other than that very specific diagnostic criteria.
So if someone came to a specialist, what are these specialists called?
So there's not a specific specialty. Like when you talk about specialists, it's like you have a heart issue, who do you go to? Well, cardiology is the heart specialist, right? Or you have a neurological thing, you're going to see neurology, or something with your gut, you're going to see a gastroenterologist. So there's not a specific specialty for hypermobility, or even for connective tissue disorders, really. The closest thing probably would be a geneticist. Certainly when it comes to some of the other forms of connective tissue disorders and even some of the other forms of EDS, typically the geneticist is someone who can diagnose and sort of be a place to refer you to the different specialists that you're going to need. But because you have connective tissues all over your body, a lot of times these people struggle with very widespread systemic issues. So they really end up with a team full of specialists. But to answer your question, when it comes to diagnosing, so it could be a primary care physician who just happens to be knowledgeable about hypermobility. It could be sometimes neurologists are knowledgeable if they deal with dysautonomia patients. Sometimes cardiologists have some knowledge of connective tissue disorders and hypermobility. Rheumatology sometimes, or pain management specialists sometimes, because there is a big overlap with chronic pain. So there's not a clear-cut answer to that. It really just depends on the specialist and whether or not they're knowledgeable.
And I think something that, you've taught me is that's important for people to understand is that you can have a very hypermobile joint, but not have hypermobility. Maybe you twisted your ankle at some point. Maybe you're a pitcher and you've been taking your shoulder through an extreme range of motion for a long time. And that particular joint is really hypermobile, really flexible. That doesn't mean that you qualify. Is that correct?
Yeah, you can have, someone who's repeatedly sprained the same ankle over and over. Maybe their ankle's hypermobile now, but the rest of them isn't. You can also have just like peripheral hypermobility. So some people may have, fingertips and toes that are really hypermobile, but nothing else on their body.
But that would still be considered like part of the hypermobile spectrum, yeah?
It would need to be more than just the fingers and toes to be like generalized hypermobility.
Got it.
Yeah.
Got it. Okay. Question number 2. This is not a question. What is this? It says, this would be like a quote. No, you're not crazy. The invisible struggles of hypermobility.
Yeah.
So what does that mean?
So, you cannot see hypermobility. I mean, you can if you see people contorting their bodies into all kinds of weird shapes.
By the way, both Katie and I were diagnosed with hypermobile Ehlers-Danlos. Do we look like hypermobile bendy people?
Yeah. So we hear that sometimes, like, oh, there's no way that you have EDS. Like you're not sick enough, or you're so normal or whatever. I think, people issues, migraines, vertigo, like there's endless things that can relate back to hypermobility. And a lot of people have struggled for a long time to get answers as to why, why do I seem to struggle more than other people? Why does this happen to me? Why did I have organ prolapses with no like explainable reason for that? And the typical, they call it patient odyssey. So the typical length of time on average that it takes someone to be diagnosed finally with EDS is 10 years. So that's on average. It takes people a decade to finally find someone who can connect all the dots. Because it's like, our medical system is very siloed. It's like you have a heart problem, you see cardiology. You have a GI problem, you see a gastroenterologist. And so it still requires someone to zoom out and look at the big picture and connect all of those dots.
Mm-hmm.
And there's a saying that is, when you can't connect the issues, think connective tissues.
That's fun and cute and also sad.
It is sad because a lot of times people are really, dismissed. And in the world that we're in now, people can look things up online or, sometimes they start to learn about hypermobility and go, wow, this really explains a lot. This really fits my situation. And then they'll get the courage to bring it up to a doctor who may not be very knowledgeable and who could often be very dismissive. And so it can take them a lot of time to get the courage to bring it up again to a different doctor and, finally find someone who is knowledgeable.
So how long was your odyssey?
I mean, I was diagnosed, I'm trying to think how old I was. I think in my 30s. And mine was after having...
How's that possible? You're in your 20s.
That's cute and funny. I love you. I'm in my 40s. Yeah. So, for me, it was, I had organ prolapses, and after childbirth, and that was one of many things that pointed to that. But that was ultimately the thing that really kind of led me down the road of learning about hypermobility and kind of seeking out a diagnosis.
And my odyssey was very short because the definition of this patient odyssey is like when they start looking for a solution to when they get diagnosed, correct?
I believe so.
Because first of all, I didn't start looking, and Katie saw me and was like, "Hey, you're a lot more flexible than I am, and you kind of look like you might have some marfanoid tendencies," which it's a genetic issue that could have some cardiovascular stuff involved.
You were just really tall and you had really long fingers and toes and stuff.
So I went to a geneticist, and within 30 minutes, he's like, yeah, you have Hypermobile Ehlers-Danlos Syndrome. And I was like, all right. And he's like, don't lift heavy weights ever again. And I said, okay. And I went and lifted my heaviest deadlift of my life, still to this day, after he told me not to do that. And
just in case anyone wondered which one of us is the most stubborn.
Are you kidding me? You can't go off that one example for stubbornness. Okay.
Yeah.
Do you have anything else you want to say about that?
I don't think so.
Okay. Question number 3. People that are hypermobile are often weak. They may feel very tight at times, and that may make you think that it's like a muscular issue. But why do people need to strengthen? And why does it feel like it's so impossible for them to do it? Hypermobile people in particular.
Yeah. So, I mean, if you think about the body, you have a bunch of bones, right? And then you have connective tissues that connect your bones and help you move. Wait, oh, you're just showing. I'm like, what are you?
I'm demonstrating movement, like just in case the listeners aren't seeing the video, we're moving.
So, and your muscles help hold everything together and move you as well. So if you have more range of motion in your joints than an average person, the muscles can work harder to just kind of hold things together and provide some stability to those joints. And this can result in people feeling really tight. It is a common complaint with hypermobile people. that they feel tight. And there are some people who are very obviously hypermobile. And when you bring it up to them, they're like, oh, me? No, I am so tight, but then they proceed to like bend over and put their forearms flat on the ground without bending their knees. Like they're clearly hypermobile, but totally unaware because they feel so tight. So yeah, and then, when people do strengthen in the context of hypermobility, they're really just helping provide, again, more stability to those joints, which can help with all kinds of stuff, including the chronic pain. The problem with it is that a lot of times people have the best of intentions and will, start a strengthening program, but then will get injured. It is also very common for people who are hypermobile to get injured more easily, and for those injuries to take longer to heal and recover from. So it can be a really discouraging cycle that people get into. They understand that strengthening is important for their hypermobility, but then they get hurt, and then they can't, and then they have more pain, and then they try again, and it just happens over and over. And so it's really important to train with someone who understands the unique needs of someone who's hypermobile.
So someone in our community asked yesterday, our Hypermobile community specifically, they were like, there's so much conflicting information from my different specialists. Some people are saying to stretch, some are saying not to stretch. And the reason being that when you stretch a joint that is hypermobile, you tend to not really stretch the muscle, and instead you start stretching the ligaments that are holding the joints together. And I argued that you're always going to be stretching the muscle. If you're lengthening it, you're stretching it, but maybe not to the extent that you would normally stretch a different muscle in the body. For instance, when I do this with my shoulders, I don't really feel a stretch until I get to the end range, just a tiny bit. But when I bend over to touch my toes, my hamstrings immediately have a lot more tension. So some joints are going to have a lot more laxity than others for people that have hypermobility. Why did I even talk about this? Anyways, I think people often focus on stretching, and how instead you may want to actually focus on strengthening. And that process, go ahead.
Yeah, and sometimes for those people who feel really tight, they want to stretch, and that can provide some immediate relief short term, but long term it's not helping. And yes, building strength oftentimes can help and really alleviate that feeling, that discomfort, that feeling of tightness that can be a little achy, or, that can cause some pain. But it takes time to build that strength and see those results. And so in the meantime, I prefer teaching people to do some self-massage with balls or foam rollers, if they're having that sensation of tightness, as opposed to stretching. And it's not to say that someone who's hypermobile can never stretch or that it's not safe. You can, and there are certain areas of the body that I stretch and need to stretch. And that's the other thing, is that not every area of your body is going to be hypermobile. Like some areas, will feel tighter. But it comes down to understanding your body and the stretches, and, and building that kind of prerequisite strength.
And this argument for strength is, now people, in most instances, if you feel tight when you're moving around, you always have this achy tightness. You do a stretch, you feel some temporary relief, but you continue to have this tightness. That tightness is often neurological. Not always. You can have a torn piece of muscle that has some tightness in it because there's some scar tissue in it, but that's not most cases. Most of the cases, it is neurological. Your joint is sensing that there's a lot of instability, so the muscles are trying to create tension to create stability. So by strengthening, you're telling your nervous system that you have stability of the joint, and your nervous system will then stop telling your muscles to tighten up. So that's why strengthening actually helps you, not just a hypermobile individual, but all people that feel tightness. Strengthening through a full range of motion, gradually, slowly over time, will alleviate that tightness.
Yeah, I absolutely, this is purely my opinion. This is not like I don't have any research or anything to back this up, but my opinion is that strength training is the number one most important thing for people who are hypermobile. And even people who have, very severe hypermobility, I think people hear strength training and they picture lifting weights or CrossFit or something like that. But, strength training you don't even have to have weights to do it. You can do resistance training in other ways. Even for someone who's like on bed rest, you can still strength train. And it is, it is very safe. It is very effective. Again, when done with someone who understands hypermobility, and it has such a
Like
ripple
us.
effect, right? Like us. But it has such a ripple effect into all of the other systems of the body besides just the muscular system, and can, result in really positive improvements in a lot of different areas. So for people that do have EDS or, symptomatic hypermobility, a lot of times, again, they have very widespread symptoms, and strength training, it just positively impacts so many different symptoms.
And I want to continue this conversation, but in a little bit of a different lens. So the next question is, what does recovery actually look like with hypermobility? And it could almost be like, what does life look like with hypermobility rather than recovery? Because I think that in general, recovery is a part of life for someone that has hypermobility. So what does that look like?
Yeah, I mean, again, it requires a more gradual approach. Starting out more basic than we would start someone who's not hypermobile.
What would
And
be something basic that you could describe?
I mean, I would say pelvic tilts, but we teach those to everyone. But just teaching them general body awareness and alignment and things that, someone who's not hypermobile doesn't have to give as much thought to, because their joints have less options for movement. For someone who's hypermobile, if you sit in a chair, like, all your joints have so many more options of how to align themselves compared to someone who's not hypermobile, who can kind of just plop down in the chair without really giving it any thought.
Yeah, I always struggled to do really heavy squats compared to my peers because when I was under really heavy load, over 300 pounds usually, my ankles, my knees, my hips, my spine, shoulders, everything was just moving around like water. So the heavier it got, the more my joints would start to move around a ton, and I had to like really stabilize, and it really prevented me from going much higher in my weightlifting. I mean, I did a 385-pound back squat. I'm happy with that. I don't need to do more. But that seemed to be a huge limiting factor, was just the options that my joints had to move in.
Yeah, and that's exactly why, like, I wouldn't take someone who's hypermobile and tell them to go jump straight into CrossFit if they had no, background or foundational understanding of movement and strength training. Um, the form and technique and the speed at which you progress and how hard you push yourself. And again, the recovery, which I think is where you started this question, is really important. I mean, for anyone, but especially for, again, someone who's hypermobile.
And I think that, for like beginner exercises for someone that has hypermobility, isometrics are a great place to start. So you're not actually moving a joint. So an isometric exercise is like a plank. Plank is where you just hold yourself. I'm not saying to go do planks. Some people have wrist and elbow issues, and that's difficult. But that would be an example of, you could do that with every joint in the body. So isometric hold. So you're not moving the joint. And that is a great place to get someone that's hypermobile to build an initial base to then start taking the joint through full range.
Yeah. And it is not easy. Like, sometimes I think people hear isometric strength training and they're just like, that's easy. And it is not. Especially if you're hypermobile, it's not. Because again, your joints have so many options of where to move. So just controlling that is really taxing. It's very challenging. I think it's actually easier to move sometimes than to not move. Like, trying to hold everything stable can be harder than moving.
Well, we'll tell people like just move this one joint and don't let the other joints move, and that right there will cause your brain to explode. And it's helpful to get people to improve their proprioception, because that is something that people with hypermobility struggle with.
Mm-hmm. Yep.
Walking into things was a big piece that we tend to do in our videos because they don't have proprioception. Okay, last question.
And that's where one of the things with proprioception that we like is having people work out in front of a mirror, because it can be really helpful for you to see what your body is doing in space, and it can really help you connect, and understand your body better and control your body a bit better in your movements. The next best thing would be, recording yourself, but that's not going to give you real-time feedback. So, when you see mirrors in the gym, like I like to have mirrors in our gym. It's important to me, and it's not a vanity thing. It's because I like to see what my body's doing. I like to look at my form, because there are a lot of times that I swear I have good alignment and good form, and then I look in the mirror and I'm like, oh, that is not what I thought my hips were doing, or
Little trick. Some people in our community will actually film themselves and they'll screen share their phone to their TV. So they're like, or their iPad or something like that. So they can record themselves and they're watching the TV and they can see themselves from the side or the back or whatever on the TV. And it's kind of, in a way, it could be better than a mirror.
Yeah.
And then the next step up would be to record yourself without looking and see if you were able to achieve that movement without seeing it. Okay, last one here. How do you set up your life for a stronger, more stable you?
That's a good question. I mean, well, you live with me, so we have a lot of opportunities for movement in our home. We have a lot of different seating arrangements. Like if you look at our living room, we have a couch and a chair, but we also have these little Zafu like meditation pillows. We have bolsters. We have, like a built-in fireplace bench that we'll sit on. Even right here, I'm standing in front of a standing desk, which goes up and down. I have a big stability ball that I can sit on or put a leg up on. I also have a half foam roller down here that I use like to do like little calf raises on, and just we have tools kind of all over our house, so it makes it really easy to get that movement in throughout the day. And then we have our gym where we film stuff and work out as well.
And would you say that everyone needs to exercise every day? What does exercising look like for someone with hypermobility?
Yeah, it can look different from person to person. It can look different to the same person from day to day. Again, a lot of times these folks will have other co-occurring conditions, and if they have a flare-up of one of those, it may impact their ability to, exercise. Also, women throughout their menstrual cycle can have, times when they're more symptomatic or less symptomatic. So, exercise may look different, when they're menstruating versus the beginning of, their cycle or whatever. So, it might be going for a walk. That might be it. It may be just laying on the couch and doing some isometric neck exercises, or it might be pushing yourself and going for a run, or, lifting heavier. Like there are days that I go down to the gym and I feel great and I will push myself. Like that's a day when I'm going to try to lift heavier than I have in a while, or, really challenge myself with something new. And then there are other times where I'm not feeling as good or not feeling as stable, where maybe I'm going to do something a little bit, more ground-based, or, lighter weights, or more of the isometrics again, or using resistance bands. So it just varies. And, I think one of the great things that we teach people is how to understand their own body and how to make those modifications, and how to learn and, teach your body or treat your body like a science experiment a little bit. And some of it is trial and error. But eventually you learn and you're able to just go off of how you feel and kind of know what your body needs.
You mentioned co-occurring conditions.
Mhm.
What does that mean, and what are the conditions?
Yeah, so I mean, there's a lot of different conditions. The main ones that are often referenced are mast cell activation syndrome. It's also the acronym is MCAS. And then dysautonomia. There are a lot of different types of dysautonomia, but the most commonly spoken about one is POTS. So that's postural orthostatic tachycardic syndrome. And so POTS, MCAS, and EDS are sometimes referred to as like the trifecta. You can have one of them without having the others, but it's also common for someone to have all three of them to some degree. Again, that not every person will have that, but they are commonly seen together, kind of in a cluster. And then in addition to that, GI issues can be very common, and those can stem from dysautonomia or MCAS or other reasons. Pelvic floor issues can be very common. Hernias can be common. So there's a lot of different co-occurring conditions that can come along with it, and it's not going to look the same for everyone. But there are patterns that are seen throughout the community for sure.
And you mentioned that the process can be difficult, can be challenging. Where can people realistically find someone to start making a positive change in their body, start building confidence, and start building an understanding of what their body can do? Because I think they might be stuck if they're listening to this.
Yeah, I mean, we have a few podcasts on hypermobility. We also have a free resource guide that we made on hypermobility. So if you are, kind of just starting to learn about it, or maybe you're thinking about bringing it up to your doctor, or you're just intrigued, that would be a really great place to start. We also
That'll be in the description.
That'll be in the description. We also go over, again, it's completely free. You'll get, 5 emails, 1 email a day. And it's going to give you a bunch of information. We also go over a few tips, exercises, massages, stretches that can be helpful. We do use the anatomy painting in a lot of our educational materials, which I think can specifically be helpful for people who are hypermobile because, again, it helps with that body awareness. If you can see the muscle where you're supposed to feel and exercise, it can really help you connect to that area.
And if someone's like, I don't really like you guys, so where else can I go to get some basic help?
Yeah, I mean,
what would I search for? Who would I search for?
Yeah, so I mean, you could obviously search hypermobility. The Ehlers-Danlos Society has some great information. They have a database of providers. People can look in local groups. A lot of times there's like a hypermobility or EDS group. I will say that those groups can be very, very negative.
Probably scary. I'm going to disagree and just say, don't go to the groups.
They can, yeah. I don't think they're the best place to find information, but I do think they can be helpful in terms of finding providers in your area who are knowledgeable.
It could probably make you feel validated as well. You might feel real validated by your experience, but get that validation and then get the hell out of those groups because they can make you feel like you're in a really dark place.
Yeah, and our hypermobility program has a community of hypermobile people. And there is, I believe, some therapeutic value in venting. Like a lot of these people have struggled for a long time and have been dismissed and, sometimes made worse, sent to physical therapy, and they work with a PT who doesn't recognize that this patient is hypermobile and then does things that makes them worse. So, it's very understandable why a lot of these people have a lot of frustration. And I think, again, that it can be very therapeutic to express that frustration and to have like some camaraderie and some people to, empathize and who get it to a certain extent. Like, I think that is fine to do. However, at the end of the day, it is still your body and your life and your responsibility. So it's fine to vent and to feel frustrated, and yet it's on you ultimately to do something about it and to change the course that your life is on. So if you are struggling with hypermobility and you're having pain and you're having injuries and you're not happy with the things that you're able to do or the way that you feel in your body right now, it's kind of like just a hard truth that it really comes down to you. It would be great if our medical system was fabulous and you could go to the doctor and you would get help for what you need, but doctors are spread incredibly thin and everything is ruled by insurance reimbursements. And unfortunately, that's just not the medical system, at least in the US.
If you're not in the US, it's hard to get an appointment.
Yeah. I mean, I think we're great with like acute injuries, trauma, stuff like that. We're awesome at that as a medical system. But when it comes to more chronic conditions that aren't like life-threatening, the healthcare is really bad. And so it really, really comes down to the individual, and that's not fair, but it is reality. So at some point you have to stop the venting and you have to focus on, okay, but what are you going to do about it? And so I think that's a little bit what is different with our community is like, I encourage people to vent, but then, and I'm going to support you while you vent, but then I'm also going to ask you, okay, and now what can you do? What's one thing that you can do today to make a difference? And I think sometimes people think it has to be a really big thing, and it doesn't. It can be the tiniest thing that can help you start moving in the right direction.
That was one thing on this little list here. It says pacing strategies. I'm assuming that's kind of what you're talking about right then, is like looking for those little wins rather than thinking like, hey, I want to be able to go to the gym 5 days a week. Let's instead focus on, can you get to your mailbox and back? Can you put your shoes on? Can you do the dishes? Those are like the micro goals that we want to shoot for. And if those seem really out of reach for you, then maybe it's like, can I put my clothes on today without feeling, so much pain? Can I sleep an extra 30 minutes a night? Like, those are the kinds of mini goals that we want to shoot for, that when you pay attention to making those little tiny goals over and over and over, they add up to big goals and eventually are doing your bigger activities like running a mile and whatnot.
Yeah, absolutely. I think it's great to have those big goals. Like, I want to go hike a mountain, or I want to run a marathon, or, that's great to have those goals. But then, yeah, you have to break it down into the steps. Okay, well, how are you going to get from A to B? Like, how do you get from where you're at now to running that marathon, safely? And
teleportation doesn't exist yet, so you're going to have to get there slowly.
Yeah, it comes down to, again, just those little things. And, we talk about this with all of our members, but I think it's even more important with the hypermobility crew, that, sometimes less is more. Like, those little things do add up and accumulate. And sometimes people like find some motivation and they're like, I'm going to do this. And they just dive in head first. And, then they burn out or they get injured or whatever. And I would rather have someone do less consistently over a long period of time than go gung ho for, 20 days and then injure themselves or fall off. Like, you're going
or 2 days.
Or 2 days. Like, you're going to reach your end goal faster sometimes by doing less, but doing it consistently.
Yeah, doing one 60-minute workout once a week versus 5 10-minute workouts is not as good. You want to do the shorter over a longer period. Okay, on that note, we're hitting the end of our time here. Is there anything else you want to add?
I don't think so. If anyone has questions, please leave them in the comments. We will do future podcasts on hypermobility. I have reached out to a few experts. We've had Dr. Linda Bluestein on in the past. There are a few that I want to have on soon. So leave your questions. We will either answer them in the comment section or on a future podcast. Or if we don't know the answer to them, we will get an expert on who can answer it.
Great. So thank you all for listening. If you haven't yet, please subscribe, follow us, like us, all that stuff, whatever. And we're on other social channels. That's where we started. So if you're seeing this on YouTube, we started on Instagram. Our handles are at Whealth, and our website is spreadwhealth.com. And our handles are spelled W Health as well. It's Whealth. So everyone, whenever this is being posted, have a great week, have a great weekend, have a great night, whatever.
It's our weekend.
We love you.
Friday.
It's our weekend. All right, everybody.
Yay.
Take care.